will be sending out a copy of that recording to all of the registrants. The reason that we're doing that is today's webinar includes about 20 slides that I'm going to present on. I'd rather not bore you to death and read each slide in detail to you, so I'm going to cover things at a high level, and then at some point I will pass it along to my friend and colleague Scott Byrd, who will actually walk you through our product and do a demonstration of how easy it is to have a patient encounter within Amazing Charts. So to get started, today's presenters are going to be me. I'm Adam Lombardi. I am the Director of Sales and Business Development here at Amazing Charts. I've been with the company a little over 5 years now, and Amazing Charts itself just celebrated its 15th birthday. Also joining us is Scott Byrd. He is our Senior Implementation Specialist. Scott started with Amazing Charts a few months before me, so he also has been here over 5 years. And his roles have basically straddled the line between sales and support the entire time, so he's gotten a great amount of product knowledge built up over the past few years. So I think his part will be both informative, educational, and entertaining as well. At the end of today's webinar, I'm sure some of you may have some specific requests, some one-on-one questions, anything like that. There is a chat box at the lower right-hand section of your control panel. You can feel free to type in any questions that you might have. If we have the time or if they seem appropriate, we will answer those questions to the group. If not, we will follow up with each of you with a one-on-one and offer to set up a more detailed one-on-one demonstration. All of my representatives in our sales department are completely fluent and capable in Amazing Charts that they would be able to walk you through a full demo and cater it to the needs and specialties of your practice. So with that, we'll get started, and I'll start breezing through the slides for you. So what we're going to be covering today is the effects of poorly designed EHRs, how to define usability within an EHR, and how to find a usable EHR. Again, the Q&A session will be at the end if there's time and if there's some questions. So the effects of a poorly designed EHR. Poorly designed EHR has a negative impact on physicians. It's obviously time-consuming. The big part that we hear about is a lot of extra typing, extra clicking, click here, click this box, go back and look here to see what I put there. It can be a little bit overwhelming from the stories that I've heard. With the time constraints, you're either forced to see fewer patients or to stay later in the office. Neither of those is obviously a win for somebody trying to organize a business and probably managing a family at home as well. The interference with the face-to-face patient care, I'm sure everybody's very familiar with this. When I go to my primary care physician, same deal. He talks to me about the EHR since he knows what my background and my business base is. So if you ask a physician what they want from an EHR, usually the first thing they're going to say is, I want one that's easy to use. And that opens up a broad scape of what does that really mean and how can we define usability. So what we look at first is going to be the user interface. You want to avoid something that's cluttered. This screen here that I'm looking at, right when I look at it, it's distracting to me and almost bothersome where I have clearly multiple windows open that I would have to move one aside to go back and look at something from a previous one to see what I meant to do. One of the things in the bullet points here that is factual is that it can lead to cognitive overload for the physician, and it can reduce your ability to make sound evidence-based medical decisions because you're frustrated and you're seeing colors and checkboxes all across the screen. It's quick and easy to lose sight of what you're actually in that room to do, which is deal with the patient encounter. And then the oversimplistic design, this one here, I mean, basically you're looking at, looks like a Word document where it's just got a list of, you know, what the person's problems might be, their family history, etc. This approach, it's typical in cloud-based EHRs, which you'll see. They use web browsers to present the information. And because it's cloud-based or web-based, the download time for each page is going to differ depending on how your network connectivity is and how much information is actually tied to that page you're downloading. So with a web-based EHR, at times you might find yourself clicking and then waiting, and then the screen pops up that you're looking to do. That obviously can get frustrating, as well as those few minutes of time waiting will add up over the course of the day. So here what we're looking at, this is an amazing charts user interface. So it's something that I'm familiar with, but it does look easier to manage for me. For somebody that's seeing it for their first time, it might look a little cluttered, color-based, things like that. But when Scott goes through the demo, I think that you'll see that it's very intuitive. One of the things that makes it much easier is you don't see multiple windows popped up. You don't see multiple pages that you have to go back and forth and look where you clicked. Everything having to do with that patient encounter is listed right there on that one page. So anything that I needed to see about the patient with that encounter, a previous encounter, anything like that, I'd be able to look at immediately. So here's something about don't codify too much. Here's an EHR that has way too many checkboxes. There's a lot of data, a lot of numbers, a lot of information on this screen. While it's probably great in collecting a high amount of content, it's not going to be great for that end user who's just trying to make it as simple as possible to go through an encounter and have this patient on their way home. So with this, it might be almost of an overload for what you're looking for and would lead to probably systematic frustrations a lot quicker than other EHRs that you might come across. So one of the ways that you can define EHR usability is to count the number of clicks. I know that Scott has done this before in comparing us with several different EHRs and showing how few times you actually need to click on something in Amazing Charts to complete the same exact encounter as you would in a competitive product. Workflow can be complex, such as documenting an assessment. So all of those things, you want them to be as easy as possible for the documentation. When comparing EHR systems, literally count the number of steps required to complete a task that you're going to do repeatedly during a day. Here they give examples as documenting history of present illness or the review of systems. And pay attention to, okay, this one took me 5 minutes to complete this section. This one took me 20 seconds. Now, the difference between that, we're talking 4.5 minutes. It doesn't sound like a big deal. Multiply that out over 20 patients a day, over 5 days a week, and think about the extra time that you're spending just on that one simple documentation task. That's not even the full encounter. And then capture the narrative. So with capturing the narrative, you want to be able to record the real narrative of the visit, what's going on. You know, you want to be detailed. I've heard stories before of malpractice cases where surgeons given 2 charts that they completed on the witness stand with information blacked out. And because their documentation was so minimal, with the information that was blacked out, which could have been name, gender, anything like that, they couldn't tell between 2 charts which one was a 25-year-old athlete that hurt his knee in practice and which one was a 65-year-old woman who hurt her knee in a fall at home. So you want to make sure that you are able to document clearly and also concisely, but at the same time with less time doing that documentation. So how to find a usable EHR? That's like the golden search for everybody. How do I find the easy one? How do I find a usable one? Number one here is something that I would definitely lean on. Listening to your friends, listening to your peers. We do it with other things. We see a friend driving a car that we've thought of buying and we'll ask them 100 questions about that car. How do you like it? How does it handle in the snow? Does it have power windows? Things like that. So the same thing should apply to using software in your office. And I'm sure birds of a feather flock together. So you probably do have peers that are in similar specialties to you. So they would be looking for a similar tool that you are. I would always trust the word of a friend over the word of a sales rep at any company. Obviously, my friend has no incentive to push me towards something versus a sales rep at any given company whether I'm looking at a car, software, whatever it may be, obviously has some incentive in back of them to try and get them to get you to come aboard with them. Testing it in your office, also a no-brainer. Same thing going back to a car. None of us really walk on a car lot and point to the car and say, that's the one I'm going to take. We always test drive a car. We play around with it. Sometimes we even go back. We'll test drive it, wait a month. Maybe I'll try it again, go back. You want to take that same approach with using your EHR before purchasing your EHR. You want to make sure this is a good fit for you. This is something that's intuitive for you. If it's something that forces you to think outside the box and focus on what you're doing aside from just dealing with a patient, it's probably not going to be the best fit for you. Over time, anybody can learn repetitive motions. So you or any staff member over time can learn how to use any EHR, I'm sure, but the difference is with an intuitive-based one, it's going to basically be understanding why you're doing it instead of having a checklist of here's the steps that I have to do to see a patient. Instead, you can walk into the office and say, hey, John, how are you feeling today? And go through your regular encounter and document as you normally would have. Contracts. You want to avoid working with companies that require long-term contracts. Contracts can be anywhere from 1 year to 5 years I've seen in the industry, and there usually is no out on these contracts. So I've come across some clients in the past that were 2 years into a 5-year contract and were miserable with what they were using and came to me and said, Adam, I really need something better, and I'm under this other contract, but I'm willing to just eat that money and find something that I love. They ended up coming on with amazing charts and continued to pay our competitor for the remaining 3 years and didn't use their product any longer. They tried getting out of the contract, but obviously contracts are there for a reason, and the companies are very, very reluctant to let people out of those long-term contracts. So unless you don't mind throwing some money into the wind like that provider ended up having to and continue paying for a couple of years, I would look for something that either has no contract or maybe a 1-year term. You want to make sure that it's something that you're fit for and it's fit for you before you move forward with it. And then overcoming the fear of switching. Switching obviously is the game now. Most of the physicians out there either work in an office that uses an EHR that they're familiar with, or they work in private practice of their own and they're under a contract or using a software system of their own now. Switching from one EHR to another, there's stories of nightmares, there's stories of, rainbows and unicorns and how it worked out perfectly. Somewhere in between those two is the reality of the situation. Most of the EHRs that are in the market today are certified for meaningful use stage 2, which means they are required to be able to export and import all of the information included in a CCDA. Most of that information is what you're going to need to move that patient's information from one chart to another. Chances are you're going to lose a lot of your narrated notes, things like that with a simple conversion. But the more important things, problem list, medications, allergies, demographics, those types of things, will be able to move over seamlessly usually from one EHR to another. And then another place to look besides asking your friend is surveys. And with surveys, you want to check the source of the survey. So the first one that's listed on here is CLAS, K-L-A-S. And CLAS is basically something I compare to consumer reports for your household items, but it's based on software. So you could research in CLAS comparing various EHRs. Let's say you're in the market today to look to switch to something and you have 3 or 4 that are on your mind. Maybe friends mentioned them, maybe you read some stories that they were good, maybe the price is right. What I would do is take a look at some of these surveys and find the 4 software products that you're looking to migrate to and see where they rank against each other. All of these companies that offer these studies, CLAS, Black Book, Medscape, the AAFP, all of them are separated from the software companies. So the way that they handle these surveys is they actually reach out to users and find out what software they're on and then ask them questions Sometimes the questions are simple, like how do you like it? Would you use it again? Are you considering leaving? Would you recommend it to a friend? From that, there's different rankings that'll come out, and then they also ask more in-depth questions about how do you rank it on being easy to use, time spent in documentation. So you can dial in a little bit deeper into some of the specifics in those surveys as well. Those surveys tend to have amazing charts at the top of them, so don't think I'm sending you to look at them because we're at the top. We're always at the top because based on usability and client satisfaction, we have very, very strong numbers. So once you've identified a couple of them that you want to look at, from there, we recommend that you try it, as I explained, the test drive of a car. With amazing charts, we actually offer a free trial of the software for 28 days. And what that means is that we will give you the full Amazing Chart software that you would be using as a paid client, but after 28 days, it'll lock up and you'd need to either make a decision to continue or to continue your search and look for something else if you decide it wasn't the best fit. You'll run into a lot of other EHRs that won't offer that full product demo. What they'll give you is basically a dialed down, watered down version of their software that it might move a little bit faster because it doesn't have all of the reports in it that the normal version does. So you're not truly comparing apples to apples. It would basically be like when you go to test drive that car, they let you test drive the one with the 5-liter engine, but the one that they're selling you has the 3-liter engine. So it's not going to have the speed and power of the one that you actually tried when you actually get your real car home. Same thing applies to the software here. If they tell you that they can't give you a free trial, ask them why. A lot of them are web-based, so really all they'd have to do is create a login for you and have a timely turn-off. If it's a local install version, like we offer both of those products, they can install it in your office and turn it off as well. Sometimes they might be reluctant to do either, and they'll only let you try it in that smaller demo or sandbox environment. If that's all you can get, I'm not saying, hey, beware, there's something wrong here. At least try that. You want to get your hands in it and feel what it's like to use. Make sure that it's intuitive for you. There's a reason that there's hundreds of these softwares on the market, and that reason is that there's basically a different shoe for every foot. So what might be best for me to use for documentation might not be best for my friend to use for documentation. So take a look and take a test drive of your own before making that decision. Again, here we're covering avoid the long contracts, and then also with the contracts, the other thing that you might run into is when it comes time to switch, let's say I want to switch midstream. Sometimes some of these other software companies charge a fee, almost a ransom, to get back your data. And the data, I mean your patient encounters, patient history, everything that you would want to be moving over to your new software product. There may be a fee associated with leaving your other EHR to get that information. So at the beginning, if you are in the market right now looking for a product, ask your representative that you're dealing with, what is the exit policy? How do I get my data if I decide to leave and move to another software product? And if I do that, is there a fee associated with it? Those specific questions will at least uncover if there are going to be any fees or if there are going to be any issues. A sales rep is never going to be forthcoming or proactive in bringing that up if these charges do exist. Like they're not going to say, oh, sign up with us and you do have to pay a fee if you want your data back. They're going to say, sign up with us and you'll be happy. They leave it for you to make those discovery questions and find out what's going on. Again, we talked about overcoming the fear of switching. So as I explained, anybody that's certified for Meaningful Use Stage 2 right now has the ability to export or import a CCDA, the CCDA information. Beyond that, there's also conversion companies out there. We work with a couple of them that for a nominal fee, they would actually spend about 3 to 4 weeks taking the data that you have in your existing EHR, converting your notes, your imported items, everything that they could to map it over to your new EHR, and then one day you open it up and everything's there. So it'd basically be like moving homes, and when you get to the new house, all of your furniture is not only there, but it's unboxed, it's set up, and the plates are in the cupboards already. So we're going to take a quick look at Amazing Charts. I'm going to pass the controls over to Scott and let him show you a few ways to do a patient encounter and some of the wow features that you might notice using Amazing Charts versus any other software today.
Okay, good afternoon, everyone, or good morning to those of you that are calling in from the West Coast. My name is Scott Byrd. As Adam said, I'm the Senior Implementation Specialist, which basically means my job is, as folks are switching or coming onto Amazing Charts for the first time, I work with them in making sure that their systems get set up properly and in training them how to use Amazing Charts. And because of that, I work with a lot of folks that are dealing with the frustrations of switching or the anxiety that goes along with trying a new product. And trust me, I understand. I have a boatload of unused electronics that I have at home that I couldn't figure out how to use for one reason or another. Okay, so generally the first thing that I do when I'm working with a client that is looking at Amazing Charts or is having a discussion about what they're looking for in an EHR is compare it to something they already know. I actually play the bass guitar and I play the regular guitar. I learned the regular guitar first and I found it very easy to transition to the bass because I could familiarize myself with something that I was used to. Okay. One of the things that I love about Amazing Charts and in training people how to use Amazing Charts is that I can compare it very easily to paper charts. When you think of your paper chart, you open the manila folder. Inside you've got your demographics. You've probably got, your insurance information paper clip to that. Then you have a page that ties everything together with the problems list, allergies, medications, etc. You have the encounter you're working on or the visit note that you're working on. You have the past encounters behind that piled up in date order. Then you have an area where it's separated out for labs, radiologies, correspondence letters, etc. Then maybe a rolling Superbill page. What I like to point out is that if you look across the top of Amazing Charts, we were designed by a physician, and therefore we were set up exactly like paper charts. So you have a demographics tab, you have a summary sheet, which ties everything together. You have the encounter we're working on, past encounters behind that, imported items, which is an area that will have your labs, your radiologies, your correspondence letters, etc., and account information, which is Superbill. So coming out of the blocks, when you look at Amazing Charts, if you've worked in paper charts before, you already know where the information that you're looking for is going to be. It's going to be in the same tab that it was for your paper charts. Okay. So the ease of use and the ease of learning how to get into using the EHR is very, very important. That solves usually your first step. Okay. The other instance is being able to use the EHR to fit how you like to chart. Okay, some folks like to click on things, some folks like to be very wordy, some folks like to type, some folks like to dictate. Okay, Amazing Charts kind of lets you do a little bit of everything if you wanted to. Okay, because it is set up exactly like a SOAP note, and you can see here it starts with your chief complaint and works your way down your left side, then moves over and works your way down the right side. Okay. Each box has built-in templates. Okay, so you can free type in here that they're coming in for hypertension, or you can right-click and use templates and say it's a hypertension follow-up. You can even double up templates if you wanted to. So you can see here, you've got the diabetic follow-up, and then you can also see that the patient is here for hypertension, so you've got both in there. You could do the same thing in the history of present illness. Okay. And again, it comes with a whole bunch of templates pre-made. You can also create your own templates very, very quickly. Simply go to your templates, add edit templates, click add new, put in a name for the template, And you can even copy and paste from pre-existing templates that you have either from another EHR or anything that you would have in a Word or a text document. And I generally go over this in training and we'll show you how to do these because it's very, very quick and easy, but you want to customize it to be about you. The other thing that works very, very well in here and gives you the ability to do some different things is using Dragon. So by using Dragon is a speech recognition software that will type exactly what you say, like this. Patient is here for a visit. And it simply types exactly what you say. You also have the ability to use what are called commands, okay? And with working with Dragon for quite a while, we've figured out and developed a way to make commands that will actually piggyback templates for you, such as hypertension chart. And by linking these templates, you're able to put more information into the chart quicker. I find with many of the other EHRs out there, one of the biggest things that you're going to run into is how fast can I do my encounter? Okay, if you are working with a patient, you want to spend the lion's share of that visit speaking with your patient. And then you want to make sure that if you do spend the lion's share of that time speaking with the patient, that you're not having to work a ton of time after hours or see less patients because of the fact that it takes you so long to document. I have this set up so that it takes me probably a little under 2 minutes to do a 2 to 3 problem follow-up visit. If I'm doing that in 2 to 3 minutes, and think about your EHR or whatever you're using now, if that's taking you 10 minutes or 15 minutes to document, you could easily be losing $100,000 a year because you're spending way too much time documenting and not enough time seeing patients. Okay? It also works out that you can customize things in here as well. So you can speak as you go. Physical exam female. Now in here I've got it set up so I can do real-time charting of the patient with using a template. Yes. Next field. Normal. Next field. Not present. Next field. Normal and appropriate. Amazing Charts will also capture the problems list, so you're able to come through really quickly and document what problems you're seeing this patient for. Diabetes assessment. Hypertension assessment. Diabetes instructions. Next line. Hypertension instructions. And from here I can write my orders and write my scripts. Now you'll notice at no time did I leave the primary screen. There is a built-in decision support area, and that decision support area will tell you all the things that that patient needs. Anything that would be due would be in yellow, anything in red is past due, anything in blue is a screener. And from here you can double click and quickly access where you need to document the information. Finally, if you're doing meaningful use, one of the hardest things about meaningful use is learning how to do it. Okay, when you click on the meaningful use wizard at the end, this does chart real-time checking of whether or not you've entered in the information that you need to for meaningful use. So when you open this up, you can think of this like the checklist that used to be on the back of the baseball cards. It'll tell you what you have done or what you have not done. If you do not know how to do what it is saying you haven't done, you can simply double click on it and it will open up another window. That little window that it opens up will come over here. It'll tell you the objective, the measure, and give you all the information that you need to know about that. But most importantly, it tells you how to do it inside of Amazing Charts, so you can go back and do it very quickly. So essentially, the system is set up to train you how to do meaningful use as you go. Finally, at the end, you could simply sign off, fill out your Superbill, which is again a digital version of the Superbill, and away you go. You start with your next patient. I'm going to go ahead and send it back over to Adam now. Adam, are you still there?
Yep, I'm with you.
Okay, I'm going to pass the presentation back over to you.
Thanks.
Thank you.
Okay, thanks, Scott, for going through that. And obviously, that's just a quick taste of what Amazing Charts is like, but that was the full encounter screen. And as Scott showed, there's 3 easy ways to document, and it's basically pick your own poison. What is the easiest method for you? Scott demonstrated both the free text and the Dragon, and then also using Dragon Medical to call up some templates. You can also manually use templates if you prefer. So if, say, during cold and flu season, you can create templates specific to cold and flu. Everybody that comes in for it, click cold and flu, populates the chart, and you can change the small details to make sure that you're documenting correctly, you know, things like pronouns, him, her, he, she, etc. So just to recap what these things can do to you by making the wrong decision and what they can do by making the right decision. Obviously, a poorly designed EHR or a poor choice of an EHR, even if it's a well-designed EHR but just not the right fit for your practice, can have a negative effect on your practice. You want to try and avoid getting something that is going to interfere with your workflow. The way that your office works is the way that everybody knows to work. You want to try and find something that can basically plug in and play along with the way that you practice medicine and the way that your staff handles your encounters, your patient flow, moving them from office room to exam room, and so on. Things that you want to avoid, the cluttered designs, the multiple screens, that first one that we looked at with the multiple windows. I don't know why that one frustrates me so much, but whenever I see it, it tends to irk me a little bit. How to find a usable EHR. Again, count the clicks. Count the number of times for you to do a simple procedure that you're going to do repetitively throughout the day. Figure out how long it takes you to complete that one procedure and figure out, okay, now based on 20 encounters, 15 encounters, however many it may be, here's how much time I'm losing daily, here's how much time I'm losing weekly. It's quickly going to add up to more than the time that you would spend on an encounter. So either you're losing money or you're staying late. Both of those things are obviously negatives. And again, don't fear the switching process. With us, if somebody's going to switch to Amazing Charts, we have that ability to import the CCDA. The product that you're using now probably has that ability to export the CCDA. Some of you are still on paper, I noticed, with some of the answers I got. So clearly that transition is going to be a little bit easier. Some of your paper charts, you can actually just scan them into Amazing Charts, save them under the imported items directly tied to the patient. So Jane Smith comes in to see me, and it's the first time I've seen her in Amazing Charts. I could click on her imported items, and I can look at the last encounter that I had with her on paper and remember what we discussed then and do a quick follow-up in Amazing Charts to get started. If you want to try and work on migrating your complete data, as we discussed, notes, imported items, your documentation, we can tie you up with one of our partners, as I mentioned, that would be able to handle a customized data conversion and take that data that lives in your current EHR, convert it to a language, and map it, so it will then reside in Amazing Charts when you start using our software. So if you do have any questions today, I'm going to take a look and see if there are any. I hadn't seen any come in. But you can always reach out to us. Our website is amazingcharts.com, and you can go onto that website. You can request a demo. You can download the free trial on your own. Downloading the trial can take 30 to 45 minutes, and sometimes it can be affected by your computer not having all of the Windows updates run. So if you're not an IT person or at least IT savvy, I would probably say just reach out to us, and Scott or one of my colleagues would be glad to assist you with installing it. And before investing that 45 minutes or so to install it, I'd encourage all of you to sit with one of our specialists and just go through a full demo of the product. Let's make sure that this is the vehicle that you're looking to drive, to use that analysis again, and we'll make sure that it's the fit for you as well, based on your specialty, your office flow, the type of work that you're doing, and how you're documenting today. From there, we can set you up with the free trial. Our free trial also will include hands-on training. So during those first 28 days, it's not like we're going to toss you the keys to the car and say, see you in a month, let us know how it went. We're actually going to work with you during those 28 days. We're going to do a customized training for anybody that is at provider level within the practice, so we can go over the patient encounter, proper documentation, etc. And then we'll also do a dedicated one-on-one training for any of the staff members. So the front desk, the nursing staff that might be rooming patients, etc., showing them how to use the scheduler, how to enter demographics, how to run reports, things like that. If you do want to reach out to me directly, for those of you that have a pen handy, my email address is alombardi, L-O-M-B-A-R-D-I, @amazingcharts.com. And my direct phone line here is 866-382-5932. My extension is 3364. If you dial that same toll-free number and press option 2, it'll go to our sales box. If you leave your name and number and the best time to contact you in that sales box, one of my reps would reach out to you and be able to do a quick demo on the spot and schedule something for a little bit more time at a time of your convenience, whether that be morning, afternoon, or evening, depending on when it's convenient for you. I assume most people would prefer to do that type of a demo outside of work hours, so we're not giving up patient encounters or continuously giving up our lunch like a lot of you guys did today. So let me take a quick look on any questions. Question 1, do you have a full set of templates for an aesthetic practice? The templates that come preloaded in Amazing Charts are based on family medicine. Amazing Charts was created by a family medicine physician, Dr. John Burtman, here in Rhode Island 15 years ago, and he actually used it in his office. So a lot of the templates that it comes out of the box including are templates that he used in his practice. We do offer template services where we would gladly spend time building out customized templates for your practice. But what we encourage everybody to do is spend 5 minutes with Scott or one of our trainers during that trial session and learn how to make a template. It's as simple as a click on your keyboard and saving whatever it is that you typed. So it's very user-friendly as far as creating your own customized templates. We also have a community user board for our Amazing Charts clients, and several of our clients throughout the years have taken it upon themselves to share the templates that they've created for their specialty to assist new clients that are joining with implementing and not having to create templates of their own. So there is a library of available templates that you also would have access to and be able to put those into your Amazing Charts.
In addition, if you have your templates already set up in a way that you already like them, and you have that in a Word document or some type of a text file, when you sign up for the trial and we put you into the trainings, during the provider training, I can actually show you how to customize those directly into your software. So even though you're switching to a new EHR or using a new EHR, you're still going to have the feel of the fact that it's you, because your templates can be brought over that way.
Great. And then there was another question about how easy is it to import photos that would be essential to their type of practice. Importing photos is simple. Importing anything is simple. Anything that lives on your computer, you can grab it, import it, and it would live in that person's imported items section. Also, if it's a photo of, say, Dr. Way, who we're looking at here on the screen, if it's a face shot that you want on their chart, it's as simple as grabbing it and putting it in there. And then also you can do photos during each encounter with something as simple as your smartphone. Let's say you're a dermatologist and patient comes in with an odd underarm rash. You can take a photo of the rash, import it, and now it's on that encounter chart and it's saved. It would probably take a total of 30 seconds between pushing the capture button on your phone and having it actually show up in your Amazing Charts encounter sheet.
And again, if if you go into the trial or you go into a demo, we can easily show you those pieces that you're looking for and give you something that's more of a customized view of what you would want to do. When I do trainings, I try to take into mind the specialty of the practice and how you would particularly use the software. And therefore, I would spend a lot of time going over pictures and illustrations and how to put things into your chart.
Okay. And then we just had another one come in around templates, wondering about mental health and psych specialty templates. So again, those would not appear in your Amazing Charts right out of the box. We could either work with you to create them around templates that you use. If you have, let's say, a paper form that you use for questionnaire, we can help create that into a template that lives within Amazing Charts. And with the templates within your practice, you have the choice when you create a template of, hey, this is something that I'm going to use, and I know that none of my colleagues in the office are going to use it, so I could list it as just mine. It won't show up as a template when they're logged in using theirs. Or if it's something that I think I just solved all of our issues and came up with, the new Rosetta Stone for my practice, I would then be able to share that practice-wide, and all of my colleagues within the practice would then have access to that template to use. Also on the psych and mental health templates, again, we do have the library of templates from our user base that are accessible and can be imported with just a few clicks rather than creating the templates on your own. Okay, so it looks like the questions have stopped coming in. So with that, I just want to repeat some of the contact information again. You can check out our website. I encourage all of you to go there. There's some pre-recorded videos of some specific demos. There's also some recordings of previous webinars that we've run. Amazing Charts has a vast array of services, add-on features. Today we focused on the clinical aspect, the electronic health record system. We also have EHRs that are focused on our practice management system, which is the billing software that allows you guys to submit your claims and get paid electronically from within your own office and using just your own staff. Beyond that, we offer services outside of your office. One could be revenue cycle management, which is a complete billing service where you guys take care of the clinical part, export the codes, we provide the billers, we provide the software, we submit your claims, we do the follow-ups, we mail out patient statements, etc. So we take a lot of that heavy lifting for your financial purposes off of you, and we take that on as our responsibility, and then we'll pursue those rejected claims, denied claims, so you guys don't have to deal with any follow-up. Something else that we're offering today that is growing in the industry is chronic care management services, which is specific to Medicare, and chronic care management services encourage population health and dealing with people that have 2 or more chronic conditions that are Medicare-based. And Medicare has now started a program within the last few years that allows for you to get billable, reimbursable time of 20 minutes or more spent with them in a non-face-to-face setting. So simple things that you're doing already, medication reconciliation, refilling prescriptions, going over their care plan on the phone, talking to adult caregivers if it's an elderly person, passing along referrals to specialists, etc. And now Medicare is paying, if you spend 20 minutes or more in a month working on a patient's care plan that's enrolled with you in chronic care management, you can see reimbursements of a national average around $45 per month per patient. So you can imagine how quickly that could add up. We have some practices that are probably seeing an increase in revenue of $60,000 to $80,000 a year through that extra Medicare service. And beyond that, they have hundreds of patients that are getting healthier, which really is the reason that everybody's in this game in the first place. So feel free to reach out to us. We can go over any of those services. Again, those are all webinars that are available on our website. And every Wednesday, we have a different topic on a webinar. So keep popping back in, take a look, see what we're offering. It might be a topic that's hot on your mind, and we're happy to get you educated. We want to make sure that all the providers and all the practices out there are making educated decisions with choosing their software moving forward. It makes life a lot easier for us. You know, if we can try and persuade you to go with somebody that's certified, that can offer all of these services, in the end, you're going to be happier than you would have been if you went with somebody that wasn't certified, you know, or had some lack of service that's included with their software. So with that, I'm going to thank everybody for joining today. Thanks, Scott, again, for doing the presentation, showing everybody how easy it is to use Amazing Charts. And I look forward to hearing from each of you. We'll reach out with a recording of the webinar within the next 2 to 5 days. Thanks a lot.